So what are your top tips for OTs to discuss this topic?
Other than just ask, I think the biggest tip is to recognise all the people that you work with as that they're sexual beings, and how they choose to interact with that is up to them. But recognising them as sexual beings is number one. And then take practice shots. It's have some concepts of how would you ask the question. Whether you have pamphlets that you can hand out, or I always ask on a home visit, or I always ask at the initial assessment, but having practice of talking about sex. It's really hard to talk about sex with clients if you don't normally talk about sex with family or friends. So having that practice of actually talking about sex, we're, as OTs, we're in there with people with showers and we're doing messy stuff, but we just don't ask the question.
And that practice really normalises it then for them, and it makes it just like any other occupation that we're addressing with them. Yes. The same as every other occupation that we talk about with our clients, just add in sexuality as well.
I know, I often just say, no one ever, I don't know about golf, but if someone wants to get back to playing golf, I go and find people who know how to play golf.
Exactly.
So you don't need to know all the answers.
And that normalises it for the clients as well.
Yeah, how would you teach?
I think having it in the introduction of when you give your explanation of what your role is as an occupational therapist as well, saying, this is an activity that we can look at, if it's something that's important to you. And again, that normalises it, it makes it an occupation, it puts it within the boundaries of our profession that we're addressing it. And it just makes it easier for you as the professional and easier for the client then as well to know that we are somebody that they can talk to.
Yeah, that's great. And I think it's also being really explicit that that's what we're talking about, and not trying to, make pseudonyms around, I was talking to one client the other day and they had gone and seen their rehab consultant and they'd asked, how's your old fella? And it's just and then didn't follow up with any outcomes of that. So it's actually, as health professionals, it's been lots of other people have, who've had strokes or have cancer, have issues around sexuality or intimacy. Is there any issues for you? So having some of those common lines actually help. But it's getting over ourselves really.
Yeah, and I think what sometimes helps occupational therapists is having it maybe in the booklet or the handout that they have about the role of occupational therapists, because I know even some of my friends don't know what an occupational therapist does. So if they have it in the booklet that this is an area that we address, then, it informs and it educates the user that it is something that we can look at.
Yeah, I actually love working, because I know you have lots of students through your university things. I love working with students, and if it's actually if I've got sexuality included on an initial assessment or in a goal setting form, the students will just ask the question, because it's what you do. You follow one to the other things, and it's actually, I find it's much easier even working with OT students, and they will get more comfortable asking the questions by being prompted than sometimes people that have worked in the profession for a long time. But I am seeing a change within the profession. I think definitely. When we started doing education sessions 5 or 6 years ago, we were doing some together. It was hard getting OTs to come along to education sessions, whereas I'm seeing that more people are talking about sexuality as a something that we cover, and as some areas we can be expert in.
Because the clients want it, and if the clients want it, then we as occupational therapists need to be addressing it.
All the research, as you would well know, that we've got one area is that people are wanting to know about whether sex is possible or sexuality is possible. And on the other side, we've got all these healthcare professionals that are going, don't ask me, I don't know anything about it. And no one meets in the middle.
And that's the thing, you don't need to be an expert to address it. And that's what a lot of the research shows, is that if you address it within the boundaries of our profession and show it as an occupation and something that is important to your clients, then we as occupational therapists do need to be addressing it.
Yeah, and it is that we've got experts all around. Maybe it's a relationship issue and we can refer to the social workers, or maybe it's it's actually a physical, I can't get my body into that position, and so as OTs we can work with the physios about how to do that, or I've had cancer treatment and my vagina's really dry.
Or if they need equipment, then we get to our next team. It's bumping. Yes,
because it just is that ability to figure out what's going on, and As an occupational therapist, we analyse activities, and we're good at that stuff. So I think we sit really
Use your
well.
activity analysis to break down the task that the person wants to do, and then it might be that we need the joystick to help them solve it.
Yeah. And it's just one of those things that people, we can do this as a profession. It's actually not that hard. And when we do training sessions with people, we often try and do it over 2 sessions so that we make people practice, like you've got homework. And it's always people come back and go, oh, it wasn't as hard as I thought. And actually talking to the older population is sometimes much easier than talking to the younger population. So we have all these barriers of why we don't ask the question, whereas actually it's not that hard.
No. So just inform everybody, and then we just need to educate them.